Good morning. Today, you are going to be working through a slide deck that talks about kind of problems associated with the neuromuscular junction. So, super big picture, you're going to be looking at various diseases, conditions, toxins, even organisms that can affect how a skeletal muscle contracts. And so you might find that some of these cause extreme contractions, and you might find that some of these prevent contractions. And so there's a net effect on your body because of these various things. And so I want to start with making sure that you have the right documentation in front of you. And so the sub should have handed out a chart, pre-printed on a piece of paper chart that looks something like this. So the very first thing that we're going to look at, and we're going to do the first one together so that you understand kind of what I'm going after here, is something called myasthenia gravis. And so this is the chart that you should have in front of you or kind of beside you as you go through this activity today. So in looking at the first one together, let's notice our columns here. So as we talk about myasthenia gravis, we do need a bit of an understanding of what it is. And so you'll take some notes here in what is this disease, condition, effect, and then specifically connect it to our neurotransmitter, acetylcholine. So remember, acetylcholine or ACH, that's what started an entire skeletal muscle contraction. It's what is released from the end of the neuron, and it binds to the surface of the muscle cell and excites that muscle cell, starts the entire cascade of events that we talked about the last couple of days. And then the next column, what's the overall effect on the person? This might be something like muscle paralysis or sustained muscle contractions, depending on what the thing that we're looking at is actually doing. And then over here in the last box, there are article-specific questions. And for myasthenia gravis, since we're doing it together and we're kind of doing it online, I actually chose a video for us to, a quick little video clip for us to watch together. So there's no article-specific questions. The other 4 things that you'll see after myasthenia gravis, they're actually based off of specific articles that I have selected, trying to connect whatever it is to everyday life or possibly even history. And so there'll be specific questions in this last column that come from the exact articles that I have given you. Okay, so let's look at myasthenia gravis. We're going to watch a quick video, but this is very similar to a slide that you'll see as you move forward on your own. There's going to be some pictures, and some of these pictures initially might not make a ton of sense, but after you have, in this case, watched the video or read the article, come back to the pictures and take another look at them. They should make sense after you've learned about whatever the condition is or the toxin is. In your slides, the article is hyperlinked up here in the text of the slide. And so you'll just click on the hyperlink as you move through, and it'll directly link you to the article that you need to read. So for us, first one, let's check out the myasthenia gravis video together.
Myasthenia gravis, abbreviated MG, is a neuromuscular autoimmune disease that affects the muscle. This means that the body's own proteins are attacked by the immune system, leading to a disturbance in muscle function. In a normally functioning system, neurons and muscles interact with each other at contact points called synapses, where signaling molecules called neurotransmitters are released. When neurotransmitters bind to their receptors on muscle cells, the muscle contracts through a series of steps leading to the production of a movement. At the nerve-muscle junction, the released neurotransmitter is called acetylcholine, and the receptor is called the nicotinic acetylcholine receptor. In MG, those receptors are attacked by the body's immune system, which interrupts the process of nerve-muscle transmission, leading to muscle weakness. Signs and symptoms include disturbances in gait, drooping of one or both eyelids, which is the most noticeable symptom of the disease, difficulty swallowing, and shortness of breath. Diagnosing the disease starts with a physical and neurological examination of the patient performed by the doctor to look for signs of muscle weakness. If MG is suspected, several tests can be performed to confirm the diagnosis. A special blood test can be performed to detect the presence of elevated levels of abnormal immune particles called antibodies. Electromyography, or EMG, can also be used to confirm the diagnosis. EMG measures the electrical signals elicited by muscle cells when the muscle is stimulated. In MG patients, repetitive muscle stimulation leads to a gradual decrease in signal due to impaired transmission at the nerve-muscle junction. Multiple treatment options are available for the disease, including anticholinesterase, which inhibit the breakdown of acetylcholine in the nerve-muscle synapse, enhancing transmission and strengthening the muscle. Other medications include immunosuppressant drugs, which act to block the abnormal antibodies from attacking the body's own receptors. Plasmapheresis is also used as a management option, which involves separating the patient's blood in order to remove disease-causing antibodies. The majority of early-onset myasthenia gravis patients show signs of thymic hyperplasia, which is the increased cell replication in the thymus, often leading to the enlargement of the gland. Research suggests that this increased cell proliferation creates a pro-inflammatory environment that triggers the cells responsible for regulating immunity, called T lymphocytes, to react against the body's own particles.
Okay, it gets a little meaty into the immune system, and I don't know that we necessarily need that. The last section of this video, really, she used a bunch of big fancy words to say patients that have myasthenia gravis, their thyroid gets large. And so that thyroid can be seen in your neck. And it's one of the clinical symptoms that would lead a doctor to kind of question and possibly run some tests. So looking at this picture, I think this picture kind of sums up nicely what's going on with myasthenia gravis. And we're going to go back to the chart in just a second. Make sure that we feel good about what we've written down in each of the columns. This is what we're used to seeing, the normal neuromuscular junction. So here's the end of the nerve, here's the acetylcholine, here is the receptor of the muscle cell. Acetylcholine binds to the receptor and that initiates, here's our little arrows, that initiates a response in the muscle cell. Here's someone with myasthenia gravis. Your body, if you have myasthenia gravis, your body's immune system has attacked these ACH receptors. And so these little inverted Ys, those are antibodies. And that is something that your immune system produces. And in a normal functioning immune system, antibodies are good. They help to sort of target and destroy invaders. When antibodies turn on our own tissue, that can be not so great. And so these antibodies have, number one, blocked the receptors, but also have degraded the receptors. So even if the antibody is removed, the receptor is still damaged and ACH cannot bind. So let's look at back on the chart. What is it? Well, we learned that myasthenia gravis is an autoimmune disease. Now, autoimmune diseases, they kind of live under the umbrella of question marks. Why do we get them? Question mark. We don't know. Maybe there's a genetic predisposition. Maybe there's some kind of environmental stress. There's a lot of research that says that stress on a person mentally and physically can aggravate or sort of initiate autoimmune conditions. So bottom line, myasthenia gravis is an autoimmune condition that specifically destroys the ACH receptors on muscle cells. So how is this related to ACH? With less functioning receptors, less ACH can bind. And if ACH is what produces the contraction, if you don't have enough of it, your muscles are not going to contract, and they're definitely not going to, if they do, they're not going to contract with the full strength that they normally would. So what's the overall effect on the person? Well, initial stages, you see muscle weakness and the droopy eyelids that we saw on the previous slide, any kind of skeletal muscle, kind of like we talked about with rigor mortis, any kind of condition with the skeletal muscle is always going to show up in the smaller muscle groups first. And so those eye muscles, the orbicularis oculi, those are pretty small, and you're going to start to see muscle weakness there. And so a clinical symptom of myasthenia gravis is droopy eyelids. That's kind of one of the hallmark symptoms that would cause a doctor to kind of move forward in testing. And so overall response should be muscle weakness, and that eventually progresses, especially if you're not treating the condition. You'll experience skeletal muscle weakness in the larger muscles as well. Specific article questions, we don't have any. Okay, so now that we've done the first one together, you kind of get the idea. You're going to move forward. So you're going to look at copperhead snake bites, their venom. You're going to look at botulism. You're going to look at a drug called succinylcholine, which actually is used in surgical procedures, but there is sort of an infamous serial killer that used it as well, to sort of incapacitate his victims. And then you're going to look at sarin gas, which is a biological terrorist weapon. And so as you work through, you'll read the article, you'll fill in the chart, and when you're done with this, then you're done for today.